Welcome to The Hill's Coronavirus Report. I'm Steve Clemons, editor-at-large of The Hill. Each day we're interviewing consequential leaders and innovators in the battle against the coronavirus. Today, more than 20 states are reporting significant new surges in coronavirus cases. This as all states have just reopened. As one commentator said yesterday, a lot of people want to be done with the coronavirus, but the pandemic is not done with us. Vulnerable populations continue to be big targets for this predator virus, and increasingly visits to hospitals or care centers can not only be costly, but the risks of infection can be very high. One company that has innovated and created new platforms to deliver urgent care and to test for COVID-19 at one's home is called Ready. The aim of the company is to provide relief to both healthcare providers and patients and to take stress off the COVID-strained healthcare system and specialize in vulnerable communities who are often on Medicaid. Ready currently has a presence in New York, in Louisiana, Nevada, parts of Maryland, and it just launched in Los Angeles and is right here in Washington, D.C. as well, with more plans to expand. The goal is to create an entirely new category of healthcare services that bends the curve for not only COVID-related testing and support, but across a lot of other health ailments. Joining me now is Justin Dangel, co-founder and CEO of Ready. Justin, great to be with you, and thanks for joining me today. I'm so interested in your company. And I guess first thing I would say is this weekend, I understand that many of your people were in Los Angeles at a Black Lives Matter march, and you were giving free COVID testing out to people. How did that go?
That's right, and thank you for having us in that wonderful intro. It was great. A couple of the organizers asked us to set up near the march in order to facilitate those that needed testing to get the testing they need, and we provided I think a couple dozen tests on the scene and have several appointments thereafter. So, obviously we support people's rights to protest as they see fit, and we want to make sure that we create as healthy a community as we can.
Now, the way I found you is you are going to people's homes. You've got folks in these various cities around the country. You're going to where people are and doing COVID testing there. And I just, it's so hard still for a lot of people to get tests and to get results, but you've kind of jumped into this, and not only going to folks with money, with status, with connections, but you're going to public housing projects. I understand you've been working with Governor Cuomo and kind of doing this. And so give us a snapshot of what tracks you're on and what you're doing given the huge testing needs in the country now.
Sure, you're right about what our focus is on. So we provide care to anybody, whether you're on Medicaid, Medicare, or commercial. I think the history of our company has been to focus principally initially on Medicaid populations in every market we enter. That's where the biggest care gaps are. Those are the patients that have the hardest time accessing the system in many cases now. And so when we prioritize our work, it tends to focus first on Medicaid, but we do a almost equal measure Medicaid, Medicare, and commercial at this point. And the proposition of our company is that we essentially have a network of responders. They're often trained initially as EMTs, paramedics, and nurses, and then we give them some more training to become responders. And they go to people's homes and are supported via video on tablets that we supply them by our doctors on the other side. So we can do just about anything you can do in a doctor's visit in the home with these responders who typically live and work in the communities they serve, and our doctors via video.
I'm sorry, go ahead.
They carry with them testing equipment. So the COVID test is one part of the test that we provide, but at this point, about 10 to 15% of our visits involve a COVID test. Most of what we're doing is providing services that historically have been provided in a clinic, and either because the patient finds it more convenient or more effective to get the treatment at home, or in many cases today, because the clinics are closed or hard to access or even risky to access, we provide really the equivalent of urgent care or primary care or clinical visits in the home.
Well, Justin, have you been able to bend the curve at all on test results, or do you suffer like all of the rest of the people out there where it's a 3 or 4 day process in terms of finding out?
We've got a couple great testing partners who typically can turn things around in 24 to 48. This is a new world. No one was sitting around in February preparing as well as we all should have been for what ultimately happened. And I think if you look at the last 60 to 75 days, I have deep admiration for our lab partners and all the labs around the country that have ramped up capacity. I think things are catching up to where they need to be. I think we're in a very different place than we were, say, in late March and early April in terms of getting test results processed in a timely fashion. And I would say most of the time we're in the our labs process within the 24 to 48 hour time frame. And there's very promising new tests coming that will push things down into the 15 minutes to a half hour time frame, hopefully in the next month.
Can you tell me a little bit about your partnership, what you've done in New York with Governor Cuomo? And I ask this because it's not often, I mean, on this show, we've been talking to a lot of people about vulnerable communities. And when there is a vaccine, are we going to make sure that it's affordable, that it's accessible to all communities? And that's really where you're deployed so well. So tell us what you've done in New York and how you've made it work, because dealing with the communities you do and kind of prioritizing that is not something I hear every day.
Well, we were thinking we might go into New York at some point next year, but a couple of us happened to be watching one of Governor Cuomo's press conferences, and he said, if there's any providers out there that can help, we really need the help. We're the hardest hit place in the country. And for us, just like what we believe in as a company, that meant us. So we quickly ramped up and we approached the governor and Congressman Meeks and the mayor and others and said, is there a way we could help? And I think they were starting to get reports rightly that folks at NYCHA were having trouble not accessing the healthcare system, as a number of the clinics locally were closed for safety reasons. And we kind of raised our hand. The governor and Congressman Meeks had this idea to try to make us especially available to folks at NYCHA, and that's how it came about. And I think you're right to say it's not simple. It is a complex project that has taken us some time to get down right, but I know we've made a huge difference in a lot of people's lives, and there are folks that need medical treatment that can't get it otherwise now, and folks that need a test for whom it's dangerous to go to a testing facility. And there's a particular concentration of that population in public housing. And I guess I hope my investors, and don't kill me for saying this, but it's not as lucrative as some other things we could do. But that's not really why we set up the company. We set up the company to try to help as many people as we can and close gaps. And that was the biggest gap that we could find in New York to try to help fill. And I think I'm really proud of the work our team's done in New York, but also all around the country, whether it's helping with the homeless populations in Las Vegas, whether it's helping to support the DC Fire and EMS, whether it's supporting the governor of Maryland, or whether it's just any of the patients that, the hundreds of patients who call us directly every day. I'm really proud of what our team has been able to do, and we're, in the somewhere around 15 to 20,000 visits a month now, and growing quite quickly around the country. So we're starting to be pretty substantial, and looking forward to growing as much as we can if we can find the partners to do it.
It's fascinating to see it. I really just enjoyed downloading your website. I was thrilled you're in Washington, D.C. Looks like you do a lot of stuff, outside the COVID arena as well. But I guess one question I have is, how do you make money? I mean, if I can ask that, because it does seem like, you do take it, but you're also dealing with, as I understand, uninsured people. So what is the business model of helping those most in need?
I think there's 2 points I'd make there. First, we contract with insurance companies as a physicians group, and we bill physicians E&M codes. I think if I was going to express the part that's been the most frustrating for me, is that some of the payers in new states, some of them have been great, like Centene and United. Others have been quite a bit slower in contracting with new providers. And I have to say that's been kind of hard to understand, as many of them have seen their claims drop quite a bit in the last quarter or so. And particularly Medicaid providers are seeing additional new members. Why they would be slow in expanding their network is beyond me. And I would like to think that, since they're mostly spending money that's dedicated for Medicaid and Medicare, that the managed care organizations would do what's right and put the providers that are courageously ramping in the midst of this crisis in their networks and facilitate appropriate billing. But that's how we make our money. We get paid just like a typical telehealth-based doctor's visit. We're better than a typical telehealth visit because we have somebody there in person, so we can check vitals, draw blood, administer medications, and do all the things you do in a doctor's appointment. And we save a ton of money because we cost the same or less than a typical doctor's visit, but we provide care that helps lower the use of emergency departments, helps prevent exacerbations. And we've been able to show with complex populations in our home city, New Orleans, that we can cut readmits by over 50% for some of the most sensitive populations. So we've been able to prove to payers that we can really lower costs and to also the government, but it's important to us to be able to get in network. As it relates to uninsured populations, fortunately, when I started the company, I was expecting to see a huge percentage of our calls to be uninsured patients, and in most of the places we operate are Medicaid expansion markets, and so we frequently, if we see a patient who's uninsured, they're most often eligible for Medicaid and reimbursable. So we have a good reserve for uninsured, and we provide it quite regularly, and it still fits within our financial model.
So just in case you want to, who are the good networks that you're working with and who are the slow networks?
We're happy with our partner with United and Centene have been particularly quickly. I don't feel comfortable commenting on who's been slower, but I hope that
everybody
I hope we
else
can all come together at this time and recognize that this is extraordinary times and that everyone needs to pitch in. I think we're are doing what we can, but there's some cases that we really need the support of the insurance industry to do what we need to, and we're not alone as a provider. There's a lot of providers out there. The CMS sort of changed some rules relative to how easy it is to get into states, but it doesn't do any good if the insurance companies in those states won't put new providers in network.
What cities are you planning to move to next? I know you just got going in Washington, D.C., and thanks for that. But what are the other areas you're sort of targeting to begin to look at as you expand your network?
I'd say Washington and Maryland, and we'll be in Virginia soon. We are in later stages in a market in Florida, in South Florida, and I think we're looking closely at Texas and Pennsylvania for later in the year. And if anyone's watching and you think we'd be particularly helpful in your home state, please reach out.
When we're just in the last couple of minutes of discussion here, but I'm interested in your responders that are going out and meeting people, and they're obviously testing people, and they're finding people in part who are ill, who are sick, who need support, and there's that human dimension. We've lost upwards of nearly 120,000 folks have died in this country from this terrible pandemic. How do you manage that side of the equation, and what should our viewers know about that interaction of helping people that are suffering from COVID right now?
Well, our EMTs and paramedics and nurses that comprise most of our responder force are some of the most courageous and selfless people that I know, and they are the sort of people that didn't pick their career path because they thought it would be the most lucrative. They picked it because they thought it was the best opportunity to help people. And as the CEO here, I see it as my job to try to help them do what they already know how to do well and express their values and the values of our company to people. It's a hard environment. I think anyone that says otherwise is lying. But our folks have the training and the capability to handle what they see. And there's some people that run away from things and some people that run towards them. And our responders are the kind of people that run towards stuff. And we do everything we can to support them, and we'll continue to try to come up with even better ways to support the folks that work for us. They're the best people I've ever had the chance to work with and know, and I'm just really proud to be a part of what they're doing.
Well, that's a great place to bring this to a close, because there are real heroes out there, and I really love learning about your company. So congratulations on such a strong launch and your direction on the COVID side of this. So Justin Dangel, CEO of Ready, thank you so much. And thank you all for joining me today. I'm Steve Clemons, and we're going to be back tomorrow. Be well.